what I primarily want to talk about is combining topicals with procedures, which I'm doing more and more of, focusing on the ones that I've highlighted. The bottom line here is that ultimately our unifying mechanism of action is that we can generate a cascade of growth factors. And as far as topicals go, they only have to penetrate the stratum corneum in order to interact with receptors on the keratinocytes in the epidermis to initiate a cascade. If we look at some of these other modalities, injectable and topical HA, the newest HAs we're getting here, plus the ones we'll be getting in the next 5 years or so, have the capacity to biologically interact with receptors to initiate again that growth factor cascade. And then RF, we know with its deep dermal volumetric heating, can also feed into that pathway. And ultimately, what do we get? Collagenesis, elastogenesis, and matrix synthesis. Toxin targeting the muscle insertions is really a very interesting way of the future. Restorative use of hyaluronic acid goes well beyond dividing into structure and biostimulation. I think we had a discussion about that earlier. We're moving towards the superficial as well as the deep fat compartments. We're going beyond biostimulation. The newer HAs that are coming to us over the next 5 years and so on can stimulate not only collagenesis and elastogenesis, but even upregulation of stem cells.